You guys know me. My name's Emily, and my topic was exclusive breastfeeding and its effect on childhood obesity. I became interested in this topic when I was going through my ASN program, and even though I don't work in OB or PEDS, I thought that it was a pretty relevant topic. In society today, there is a lot of controversy over how to solve childhood obesity or ways that we can diminish it. I did a lot of research on this topic, and it showed that exclusive breastfeeding and delaying solid foods might present a link later in life to reduce childhood obesity. The Healthy People 2020 objectives aim to increase the proportion of infants who are breastfed. It's one of their objectives that they strive for. And I looked up some statistics, and according to the CDC, among children and adolescents between the ages of 2 and 19, about 17% or 12.7 million of those children are obese. The Healthy People 2020 website states that only 14.1% of infants that were born in 2006 were exclusively breastfed through 6 months of age. Unfortunately, with these statistics and research, as low as only 16% of infants are still exclusively breastfed at the age of 6 months. Many consequences can come from not exclusively breastfeeding and delaying solid foods. Obesity in childhood can lead to high blood pressure, cholesterol, we all know cardiovascular disease and issues that go with that, type 2 diabetes, joint problems, sleep apnea, which we also see a lot, depression, and behavioral problems. The research also shows that if children are obese, they're more likely to become obese adults. Establishing early feeding practices when our kids are young can help combat these problems against obesity and promote healthy weight statuses later in childhood and also into adulthood. My PICO question is, does exclusive breastfeeding in infants up to 6 months and maternal breastfeeding education lead to a reduction in childhood obesity as opposed to the early introduction to formula and solid foods? My target population, based on my PICO topic, is infants up to 6 months of age, because the research shows if you start earlier, they're going to have better weight statuses later in life. The main intervention is to promote exclusive breastfeeding and implement those early education so that those feeding practices can happen early on to increase breastfeeding rates and decrease obesity. It's compared to the introduction to formula feeding and solid foods before the age of 6 months. The outcome of this research will be to prove that there is a link between exclusive breastfeeding as opposed to formula feeding. So my research, I had a lot of different articles, and they ranged from breastfeeding effect in infancy, toddlers, and all the way up to school age. So the first study, a lot of them use the same types of tools, anthropometric measures, BMI, weight to height ratios, all of those to kind of measure whether obesity was reduced. So the Generation R study was used to assess whether the duration and exclusiveness of breastfeeding and introduction of complementary foods had any association with sub-Q fat mass. So that's really what they focused on. Like I said, anthropometric measures were used, and they also used a breastfeeding history because it was kind of hard with a lot of these studies, and breastfeeding history had to be obtained as opposed to doing the studies when the kids were infants. The results suggested that non-exclusive breastfed infants and infants that were breastfed for a shorter duration were both affected negatively in the first 2 years of life. So that one did show that children were more likely to be obese in the first 2 years of life if they were not exclusively breastfed. My next article covered breastfeeding effect in toddlers. The Early Childhood Longitudinal Study cohort aimed to assess the relationship between breastfeeding and delaying introduction to solid foods on childhood obesity and a healthy weight status in children aged 2 and 4 years. So this was a little bit later than the infants. Once again, anthropometric measures and periodic assessments were used to collect the data. The data showed that breastfed children were more likely to have a healthy weight status and lower rate of obesity at both ages 2 and 4 as opposed to children who had never been breastfed. It also showed that solid foods introduced before 4 months increased the percentages of obesity at both 2 and 4 years. So that was really the first article that talked about the introduction to solid foods and the effect that it had on children at ages 2 and 4 years. My next article had to do with breastfeeding effect in school-age children. The Healthy Kids Queensland Physical Activity and Nutrition Survey aimed to explore the association between the duration of predominant breastfeeding and the waist-to-height ratio. This ratio differs from the BMI, and it actually is a better measure in some aspects. It used anthropometric measures, the height, weight, and waist circumference, and then it was used to calculate a BMI as well. The results of this one were interesting because it showed that breastfeeding was only a protective measure for females and not the males in the study. My last two articles were for school-age children. A study done in Turin, Italy was used to determine if serum leptin levels had any correlation to BMI later in life. These leptin levels, anthropometric measures, and BMI were measured in the infants, both exclusively breastfed and formula-fed. The results showed that the breastfed infants showed significantly higher leptin concentrations than formula-fed infants, and infants that had lower leptin, so the formula-fed, had a significantly higher BMI in childhood. So the link really isn't understood yet about leptin, but it kind of was shown that the higher the leptin concentration, the lower BMI later in childhood. My last study was done in Tehran, Iran, and it was conducted to investigate the relationship between BMI and breastfeeding history. There were students from all the district schools that were polled, and their mothers, and all of their breastfeeding information was taken into account. So they had the weight, height, and the BMI as well as the breastfeeding history. And the results showed that the duration of breastfeeding, the total time of formula feeding, and the introduction to complementary foods did not have a significant influence on the weight status. However, the BMI did increase with the total time of formula feeding, so the longer they were on formula, their BMI was higher, and it decreased with the duration of breastfeeding. So there was an indirect correlation there with breastfeeding. The results also showed that the mean BMI in the children was lower if the complementary foods were introduced after 6 months. With my project, I had to come up with my own experiment. I had to do the design, the setting, the sample, everything, so that I could test with research to see if there is a link. So I chose to do a quantitative research approach to investigate the possible links between breastfeeding, formula feeding, and then introduction to solid foods. I chose to do a non-experimental study that was randomized, and I think that a questionnaire would be really helpful in this because you can get some background and data for the students. I chose to do a total of 500 children ages 7 to 10 years old enrolled in 2nd, 3rd, or 4th grade, and they would be selected from the surrounding schools. So that would be my sample that I would use. And the parents and legal guardians would receive a letter that would invite them to have their children participate in the study. The letter would tell them the purpose, the procedure, everything that had to do with the study, as well as have informed voluntary consent that they would sign. So after we have our sample, then the parents would fill out the questionnaire that would give their feeding habits up until that point, if they were breastfed, formula fed, when they started solid foods. That way we can collect all of that data. And then we would use anthropometric measures, height, weight, birth date, sex, all of that would be taken into account. Once you have the height and weight, we would record their BMI and then compare that with the results from their questionnaire. So the association of the variables would be analyzed using the chi-square test, and then the association of those variables would also be used with a multiple linear regression model. So I thought it was a pretty good study. My conclusion, the prevalence of childhood obesity is increasing, as we can all see. We see it in our patients, though they're not children. We know that overweight children become overweight adults. Um, Although some of the research we can't really know the links for sure, it's pretty obvious that there is some link there. Um, so I think that it's very important for healthcare institutions, hospitals, to make it a priority that we educate our nurses about breastfeeding and pushing for mothers to really try to breastfeed, so that our nurses then can educate our patients about the importance of it and the possible benefits that it can have later in life. So it's pretty clear that it's time consuming to fix this problem, but overall, it's worth it to try to prevent and cure obesity. So, thank you.